Bleeding in pregnancy is the most dreadful complication. As a doctor and patient, we are all scared about. So when we want to discuss this topic, it's easier to discuss it in the beginning, in the middle, in the end, during delivery and after delivery. So in first 12 weeks of pregnancy, when a bleeding happens, we call it as threatened miscarriage. That means there is a threat to miscarry. So what you do is you get yourself to a doctor, get yourself checked, we advise you ultrasonography, we give you medicine, and the whole purpose is to see whether this pregnancy can be saved from a miscarriage. Now, if the ultrasound says the pregnancy is doing fine, you just need to take some rest and maybe some medication and you will overcome. 80 to 90% of patients with first trimester bleeding, they do survive this episode and they happily continue and deliver normal, healthy child. Lot of people has this question in mind that if I have a bleeding in early pregnancy, will it cause an abnormal child? There is nothing like that, because the bleeding which is happening from the mother's blood, mother's body, mother's uterus. The baby does not bleed. So if you survive a threatened miscarriage, be assured that it will be a healthy pregnancy. Now, in some cases, about 10 to 15% of early pregnancy, this bleeding is a sign of miscarriage. Suppose the baby is not formed and the pregnancy stays empty or with a dead baby. In medical terms, we call it blighted ovum or missed abortion. In those cases, this bleeding is an early sign that nature and body is trying to reject this pregnancy. So once we do the diagnosis, we see the pregnancy is inside the uterus, it is not growing, we reconfirm it if required, and then we offer medical termination in different forms. Now comes bleeding in middle pregnancy. Now that can happen due to a lot of reasons. Maybe some part of the placenta gets separated due to any incidents, accident or naturally. So from the age of the placenta, bleeding comes. In middle of the pregnancy, we all have to be worried about a condition called cervical incompetence, where the cervix starts opening up prematurely. If we are vigilant, we pick up this condition early, we can treat it and save the pregnancy. There is a procedure called cervical suturing, where you put a stitch around the cervix and you save the woman and the child from a premature delivery or a miscarriage. Apart from this, we also have to remember that local reasons like cervical polyp, vaginal infection, they also cause bleeding. So in summary, even if you have a bleeding in middle of pregnancy, just don't get worried, take precaution, get yourself checked, get an ultrasound done, take advice from your obstetrician, and you will succeed very nicely. Now in this time, some pregnancies are detected to have a placenta which is sitting near the os, that means near the cervical canal, which is a gateway for the uterus from where babies are delivered. So in case the placenta is placed in the lower uterine segment, we call it placenta previa. Now people who have placenta sitting near the os or near the cervix, they should take some extra precaution, and what happens is you become more restful and don't do unnecessary activities or sports, and be slightly careful, because a placenta previa detected in middle of pregnancy can dissolve or resolve with the growth of uterus. Now in third trimester, most of the bleeding happens from placenta previa. There is a condition called accidental bleeding also, which happens from a normally separated placenta, and obviously premature labor comes with an indication with vaginal bleeding. So you have to see whether the bleeding is painless or with pain. If the bleeding is painless, the tendency of lower positioning of placenta or placental accidents are more, and if the bleeding happens with pain, then premature delivery is a risk. If you are booked into a properly equipped hospital and been looked after by your doctor regularly, hopefully this will be detected and managed accordingly. Now, during delivery, bleeding is something which your doctor has to attend, and you have to be careful for the bleeding when it happens when you go home, which is called secondary postpartum bleeding. The usual causes are infection, sometimes little bit of placental tissue left behind, which can be managed. So if you bleed in pregnancy, do not get worried. 80 to 90% cases get sorted out, treated and managed so that you can have a proper healthy baby and delivery. So cheer up, bleeding does not mean danger only. Take care.